Well, hello everyone. Kind of neat. I wished I'd be able to go outside right now. The sun is shining real strong, and we just had some rain, and I was just out there a few minutes ago, and I saw a very delicate rainbow in the sky. I can't do it that way. Everything was reversed, so it's pretty neat to see that rainbow that you see there up in the sky. And I'm sure it's really, really nice right now. So it's kind of fun starting this evening's uh, program with a rainbow in the sky. So, anyways, we tonight we have a great show, great interview with Dr. Terrance Baker. He has years of experience with PBM going way, way back. And just to give you an idea, I mean, he's president of Knowlton, and I'll get into it in a few minutes. That's the North American Association of Light Therapy and Photobiomodulation. So we'll get into that. But I want to say for all those that are joining us tonight, we have a ultimate here that will be given away. This ultimate has the 660 and 810 nanometer wavelengths, and so just to give you an idea what kind of power this thing has, you see the light going right through that through my hand, and if you could measure the light coming through from the 810, it'd be just streaming out this side. When I put a special measurement device on there, I can see that we're looking at anywhere from 10 to 20 times the light power that we can visibly see here right now coming through my hand. So other parts of the body. So the reason why we have this kind of energy is because I got special cooling on this thing, and that's what gives us the ability to not only have a lot of LEDs, but a high concentration of those LEDs. So you can't really get that on the market. So you're not talking about, one of these big LED. If you were talking about one of these big LED panels, you'd have to squeeze it right down to get down to like this to get the kind of power that we have coming out of our device here. A lot of optical power. And with the optical power, that allows us to go not only cover a large area, but because we cover a large area, you can actually get deeper penetration as well. And with the power and the wavelength and the area, all those combined helps us to be able to get in. And as a matter of fact, like it's not a problem to get into the lungs with our light, to reach the shoulder joints, hip joints. And I think you're going to find it fascinating. So tonight's program. So right now we'll go to our video, and then we'll start the program.
15 years back, I realized that light could make a huge difference on the body. I ended up designing this very powerful light using LED technology. With this amount of very high power density, it can reach through the tissues and travel right to the joints. But the key is that the power density and the area is extremely important to deliver that light into that. The mitochondria receives that light and converts that energy into the cell. So it's like giving the cell super high octane fuel, and they run like a jet, and they're able to do all the things for repair in that. What are the products we have? Well, we have a small device, which is actually large when it comes to light therapy. You have a fairly large area of light and a high power density that can be used for different parts of the body, like your fingers, shoulder, back, neck, knees, ankle, anywhere on the body. And then we have what's called the mini canopy, which is about a foot square in size. And then we have our full-size canopy, which is basically 6 of the mini canopies. And then we have another device, which is the helmet, and that device can help for mental issues, for brain injuries, for concussions, for PTSD, TBI, all of those kinds of things. And there's new research out there that shows it could be helpful for not only strokes, but dementia, Alzheimer's, and Parkinson's, and just different brain issues. Our plans are to move this technology into every area of the world where there's pain and inflammation, which is basically everywhere, and to expand that so people understand all the applications where this technology can be used to help them in their health in the body as a wellness device. People are looking for how they can treat themselves without drugs.
Okay, so for those that didn't hear, I have a special guest on tonight, Dr. Terrance Baker, and just a little background on Dr. Baker. He's a graduate of Johns Hopkins, George Washington School of Medicine, MD. He's also been involved with the Medical College of Virginia with the residency training. Visiting professor for Montpellier Faculty of Medicine, owner of Soleil Medical Center in Baltimore, Maryland, and president of Soleil Kenya and Foundation, Soleil Kenya Foundation, and president of the Katina Hospital in Kenya. And president of NALT. So it's with this I welcome Dr. Terrance on tonight. Thank you, Dr. Baker, for coming on tonight. And if you can just bring your video on, we'll be all set. So Dr. Terrance has been around for quite some time in PBM, and now we got the chance to have him on. So, Dr. Terrance Baker, welcome to tonight's program.
Hello, good to be here with you.
Yeah. First of all, how are you doing? Doing well?
Doing well. I have no complaints at all, and just doing a lot of exciting things like you are with photobiomodulation. That is the use of light to heal virtually any part of the body. We recently started treating infertile patients with photobiomodulation, red light and near infrared applied together. And so far we've had several PBM babies. That is what I call
all right.
babies.
Fantastic. Bringing new life into the world with some help.
Absolutely. It turns out that photobiomodulation is very exciting for enhancing fertility in women that have struggled to get pregnant. It's a very successful technique that is being used in Canada and Japan and around the world to assist mothers to get pregnant. And just recently here in Baltimore, we started using it. We're very excited to be with you tonight to also talk about stem cells a little bit and why photobiomodulation and stem cells work so well hand in hand to heal medical conditions that you never thought was possible to heal.
Yeah, just back to the fertility for a sec. So do you feel that there's so many problems with inflammation anywhere in the reproductive cycle? Is this one area that you think that the PBM or photobiomodulation is helping reduce the inflammation, allowing then the conception to take place?
Yes, Tom, I think it's I've studied the pathophysiology at length, and I believe there's two common denominators. One is inflammation, you're exactly correct, and the second one is mitochondrial dysfunction.
Right.
So photobiomodulation is extremely important for both.
And mitochondrial dysfunction, now I think they're believing that a majority, if not all, of the diseases have a relationship to mitochondrial dysfunction. Is that how you're hearing things as well? Yeah, I think it's a growing understanding. Would you say that, or how?
No, I agree that any organism with mitochondria, any organism, whether it's here or whether it's in outer space, it doesn't matter. If the cell has mitochondria and it's damaged, it can be healed using photobiomodulation.
Oh, that's beautiful. It is beautiful when you can see all. We'll get into that later on, but how about you tell us a little more about, first of all, the hospitals in Nigeria and Kenya?
Yes, yes. So back in 2017, my nurse practitioner, Madessa Vasander, and I opened our first hospital in Katani, Kenya, 144 beds, American-based, Western, American Canada-based medicine, open door policy. Any Kenyan is welcome to show up and get treated. And photobiomodulation is an important part of what we've done ever since the day we opened. So we use photobiomodulation to treat many different conditions because medications are in limited supply and surgical procedures often that we take for granted in America and Canada don't exist. And so we use photobiomodulation as one of the tools in our toolbox to assist us to treat Kenyans that come to be seen. And then over in Nigeria, we teamed up with the National Association of Foreign Trained Pharmacists, over 3,000 pharmacists in Nigeria who were trained in America and Canada, who have returned back to Nigeria to open certified pharmacies. And in the certified pharmacies, we're running telehealth clinics, and part of our treatment is photobiomodulation. Very exciting what's happening in Kenya and Nigeria.
Wow, that is cool. That is cool. That those doors opened, and it's not an easy thing to start, is it?
No, there's nothing easy about what your team and my team and what many of your listeners are doing in their own offices and in their own homes. There's nothing easy about advancing a new science.
Yeah, exactly. Whether it's here or over there, I'm sure many of the same types of things that we hear over here is the same over there. How can that be possible? What can that do? That's just voodoo science. There's no way, that's kind of so many dispel the idea that light can be so helpful to the body. But my gosh, all you need to do is start seeing some of the results, right? And that's what we've been seeing over the last while anywhere across the body. So tell me about your thoughts on the stem cells then. We put that out there because that's a really interesting topic these days, as to how stem cells, how they operate and what photobiomodulation can do.
And just a word of 1 minute of history is for your listeners. You probably have heard the term stem cell. What is a stem cell? A stem cell is a cell in your body, or as a baby, as an embryo, has the ability to become virtually any cell or any organism in your body. So it's omnipotent, has the ability to divide into virtually anything you need it to be. And as children and as adults, we have stem cells largely stored in our fat that wait for assignment. They're just hanging out. They're not developed, but they have the potential to become anything. Any part of your body that's been damaged, they have the ability to turn into that cell, whether it's a skin cell, a muscle cell, heart cell, whatever. And so, what photobiomodulation we have found does is it stimulates the movement of these omnipotent cells, these cells that can become anything, to move within hours to the area where the photobiomodulation is applied. And so, have you ever treated something, a condition in yourself or a patient, and the patient miraculously, quote, miraculously gets better? I believe one of the mechanisms for doing that is that you're stimulating the movement of omnipotent stem cells from the fat stores of the body to the area that's damaged so that they can be assigned, those stem cells can be assigned whatever you're healing. Like, for example, we've had a number of cases of dry gangrene of the ankle and the foot that we've been able to heal, that is, to grow back an ankle and a foot over a course of 12 to 15 months, 3 treatments a day, 40-minute treatments, 12 months, and you give the person their ankle and their foot back that was dying from dry gangrene, which is basically dead cells. And so you always wondered, I always wondered, how do we do that? But I think stem cells help us to understand photobiomodulation attracting those stem cells to the area that's been damaged. They're being called there through chemical messengers that perhaps we don't fully understand yet, but clearly they're being pulled to the area.
Yeah, this is an example of an ankle, and they were going to do an amputation on that foot because it was, and photobiomodulation with our palm light was done, and within 2 months, it was healed down to that, and another 2 more months, it was totally healed. So in 4 months, it went from losing the foot before the end of by within 1 week's time. And now that person's been able to walk around with that foot that was not supposed to be there anymore.
Exactly, and there's hundreds of examples of similar injuries that have been healed in a time frame that is much shorter than you would reasonably expect just from cell division alone, just from cells reproducing under the influence of light locally. I believe the stem cells flood into the area, drawn there, attracted there by specific wavelengths of light, red and near infrared being my favorites, of course, administered simultaneously or one after another, contemporaneously, one after another. I don't think it matters. You have an opinion on that, Tom? Have you seen better results from red light first and then near infrared following it, or do you do it together?
I actually do it separate, and part of the reason is because the way we've designed our unit, we want to have maximum power of the red or maximum power of the near infrared, and then allow the person just by time to adjust it accordingly. So if they're trying to treat something very shallow, they might use 1 minute of red and 1 minute of the near infrared. And then if they're trying to treat something very deep, they'll spend a lot more time with the near infrared. And we couldn't have both wavelengths on at the same time or you'd overheat the skin surface. There's just no way. It's pretty much maximum at both wavelengths, and so we don't. But I don't know. We're seeing really, really good results over and over and over again, suggesting that people use the red first, get the blood flowing. It's not going to have the penetration, but at least stimulating the whole area. And then the blood is going to carry it further than that, but then the area that you're treating, and then come along with the near infrared. And we're getting really, really good results. Like the one fellow I show in a picture that I have is pickaxe injury, where the fellow swung the pickaxe and cut his tendon right through, and it was going to be they figured 6 to 9 months in a boot, and then he'd have rehab and all that kind of stuff before he was walking. And because he used my unit right away with the red and near infrared, very quickly the swelling came down. He started getting his range in motion, and we have him walking in the parking lot at 1 month. Yeah, the gait was affected. He didn't have as much upswing because there's still some, inflammation in the area, but significantly down, and the scar tissue was probably minimal because of the ongoing treatment. So 1 month as opposed to 6 to 9 months. So and when we're doing for eye wellness, we suggest 1 minute with the eyelids closed, 1 minute of red and 1 minute's near infrared, and I think it is quite beneficial. Well, we've seen some really good results for different eye issues. And how about yourself? What are some of the things that you've been able to see that just blow your mind, so to speak?
I started my training back in 2000, actually, right there in Toronto. And I've been treating patients daily for nearly 25 years. It's hard to believe. I never go anywhere without a unit strapped to my hip or in my pocket somewhere. Somewhere I got a source of light, even if it's a red pointer. And I've been known to use a red pointer to cure you. I've got a number of patients I've treated with a red pointer, just a 5 milliwatt red 560 pointer. But anyway, there is no condition, Tom, starting on the top of your head with hair growth or hair loss, down to your toenails with toenail fungus. There's not a medical condition that I've yet run across that I can't either heal or make better. Now I know some people think that makes Dr. Terry Baker a little goofy, but it's true. I just never run across a medical condition that I can't make better. I
Well,
just have to.
you and me
I,
both. There's two people that are these crazies that believe that light can do all these things, and when you see it firsthand, it's hard to dispute. Especially when you have people with long-term chronic issues. We have one fellow here that surgery after surgery on his back with rods in it and everything, and he's only in his 50s, and and in so much pain, and can't work, can't do anything, and he's able to he says, I can just feel like the whole, first of all, some other outer muscles started loosening up, then another layer, and he says, I've had to kind of even start walking differently because my muscles are starting to work the way they're not all locked up, and I'm not in this extreme pain that now I can actually wake up and I don't have that extreme pain first thing in the morning. So he says, this is crazy after all these years, and he's just under our large unit. That's the one that you've got down there in Kenya. It's it's literally, for those out there, it's 15 of these guys with area and about 12 times the power, but it has the two wavelengths, the bright red 660 and the 810 nanometer, which you can basically see.
yes.
It doesn't show up very well in the camera, but this fellow with the severe back pain was, he's using the large unit, which is two of those by three of them, so 6 units. So it does a very 2 foot by 3 foot area. It does a very large area, and tremendously helped. And that goes right back to the first one I made, that I got. This is in the beginning of COVID. Somebody had severe back pain for years, and it just kept getting worse, more and more debilitating. This woman, she said that she loved gatherings of her kids, but she couldn't. She loved to serve. She was hospitality, and she couldn't stand up in the kitchen for a few minutes without severe pain, from the whole thing. And she says, now I'm back to doing that whole thing, and I can do it without suffering for it from into the next day. She says, it's beautiful. Now I'm not, going to totally repair my back, but how much better that she's been. And one funny side effect, she says, I didn't even think of it, but she was using the light daily, all the time, going under the large canopy. And she said, I had always the problem with my tear ducts. If there was even the slightest of wind, the tear ducts would be running so much. She says it was embarrassing. She says it was just like the tears were just running amok, just like constantly, and hard time to see. And she says that's totally solved. Now the reverse also happens with people that have had dry eyes. I've got a unit that we'll be bringing out in a while yet, and not for another few more months, but it's a unit that goes inside the mouth and allows you to treat inside the mouth. And this one woman who is using the light treatment for burning mouth syndrome and other issues that she had from the leftovers of radiation chemotherapy from years earlier. And it was really funny with her. She said, she called me one time, and this was one of our prototypes. So she didn't realize that she needed the little adapter that went into the unit. And this little adapter reduced the power to about a third. So she didn't use that. It was full light output. So she said it got rather hot in the 1 minute. And she said, she's in her mouth, and she says in 1 minute, the thing was too hot to have inside her mouth. And I started querying her, and she says, I'm so concerned about my eyes. I says, why? She says, well, I see the light in my eyes when I put this in my mouth. And I said, well, do you have, because of the way she was coming at it, she said, I says, do you have any problem with your eyes? And all of a sudden she says, oh my gosh, she says, I have had a long history of dry eyes since I had the chemotherapy and, constantly problems. It's gone ever since since I've been using, the product. And that was probably about a 2 months of time that she was treating daily with the light in her mouth. So the helpful, finally with oral mucositis is finally the first thing that's come out that's, a approved cancer treatment, or I should say, what's the word I'm trying to use, that they used to be used alongside of, standard of care. There you go. With oral mucositis and chemotherapy treatment. So, hey, finally we're getting some interest, but for a long time, I've been at it, not as long as you, but I've been at it for 17 years now. And my gosh, it's only been the last year or two that you're now seeing it, all sorts of devices pop up on, on Amazon, and a lot of the product there is not worth the postage stamps that you might have to pay.
No,
It's
it's just junk. Well, I think the team that's with us tonight would love to meet. I have her permission. Is Dolores Salisbury. I told you last year about Dolores Salisbury. One day I went to make a house call. I'm probably one of the last family doctors to make house calls in Baltimore.
okay.
Anyway, I went to see Dolores, and her husband was dying, and she had no children, and so Dolores asked her husband asked before he died if I would take care of her, look after her. Well, soon thereafter, we diagnosed her with multiple myeloma, which is a bone cancer, as you know, that had spread widely throughout her body. So I went to make a house call, and I had your handheld unit with me that you had sent me to do research with. Yes, exactly, the palm. So at any rate, so I made the mistake. I don't know if it's a mistake, but I let her use it to treat sinusitis and to treat some dental problems she was having, and she got significant relief. And so she convinced me to leave it with her. Well, the next thing I know, she's like treating her whole body with her palm. Every place it hurts, she's lighting up. And so, she just recently died, but that's like 6 years that she used your palm every day or nearly every day to treat her sinuses, her ears, her teeth, her bone pain, her joints. Miss Dolores said, send you a big kiss and a hug because she says she doesn't know how she would have made it 6 years without the palm.
Yeah, that reminds me of my mom. She went to be with the Lord just over a year and a bit ago, and my I she used my palm light all over, but at one point she had a pretty significant fall. She was 92 years old, and she had a pretty bad fall. And up until then, she was just using the palm light, and she hurt her back pretty bad. So I decided not, that's too hard for her to try and hold around on her back. So I got her the mini canopy, the with the stand, this guy here. That's what we call the mini canopy. So I got her that to start using, and she saw, Tom, I don't know how to work it and this and that. I says, Mom, it's just a switch, you turn this way, turn it that way. And she was in so much pain, but she liked to do everything possible to stay mobile. Well, my brother is actually was across the driveway, and he lives across the driveway from the house I grew up in, and where she was still in. She was still in at her age of 92. She, would pull. She told me that, I think at 91 she was still pulling four wheelbarrows full of weeds out of the garden. Anyway, so she fell and she hurt her back, And I got her convinced to use the light. And then my brother says, Tom, he says, you'd never believe this. He says, he'd look over the yard once in a while, wake up in the middle of the night, and go and look because he has a mechanic business. So you never know. There's been problems before. So just kind of look out the window. And he says, the whole house was red. So yeah, it was funny. So she started using it, and within about 2 weeks, she was back to mobile again. Now, at 92, when you hurt your back pretty significantly from a bad fall, that's usually a very quick downward spiral from there on. And not her. That she was able. So the light on the different parts of the body, but. Tell us about some other things that you've learned along the way with photobiomodulation. Things that come to mind.
Yes. I think the thing that's one of the things that's exciting to me is this fertility project. This is our second year of enhancing fertility in men and women. And it turns out that probably the single most effective treatment that I have found, whether you're getting implants or regardless of what the source of your infertility is, photobiomodulation, a combination of red first and near infrared, about 20 joules per centimeter squared over the abdomen is very effective. You can go higher, as much as 40 joules per centimeter squared, but somewhere in that range, because what you're doing is you're providing red light and near infrared for inflammation, just like you said. There's a lot of common causes for infertility. It can start in the vagina with dysfunctional vagina, too dry, too wet. It can be the cervix, and the cervical mucus can be too thick or not at all. It can be the uterus and finding an implantation site that's adequate for the new fetus to implant. It can be the fallopian tubes and the movement of the tube, that is the fembri moving the egg and the sperm through the tube, because it's got to meet at exactly the right
Yeah.
place at exactly the right time for the sperm and the egg to get together and to begin to produce an embryo. And then it's got to travel from that tube, that new embryo that's alive, has to find its way over to the uterus and implant. There's any number of places where dysfunction, uterine dysfunction, um, cellular dysfunction, can result in a failure to fertilize the egg and to make it, or even the egg to be produced. For example, had a woman come to me a few months ago for one reason only, Tom. She wanted me to use photobiomodulation to stimulate the production of eggs.
Oh, really? Okay.
Right, right, because she wanted to implant, she wanted to do in vitro fertilization, but she needed eggs in order to fertilize and implant.
Right.
So my assignment wasn't to get her pregnant, so to speak, but it was to create eggs. So we took ovaries that were producing no follicles, and after 2 months of treatments during her cycle, 3 times a week for 2 weeks during the cycle, we were able to produce 10 eggs, 10 follicles.
Wow.
That was her only assignment, was to produce follicles. And we did. And she harvested the follicles. Her gynecologist harvested the follicles, fertilized it, implanted it, and she's pregnant. So
Beautiful. Beautiful. As a matter of
yeah,
fact, you see well, this is the mini canopy up here.
yeah,
As a matter of fact, the photographer, him and his wife were trying for 5 years. And she felt she had a little bit of back discomfort, and she thought she would try it. And she used it for 3 weeks, and lo and behold, she became pregnant. You know,
yes.
uh, like that, they were just blown away. I suggested they named their daughter Red, but they didn't do that. So,
No, I understand. And it works well for men also to increase the sperm count. you can tremendously, with your handheld unit, tremendously increase sperm count 100-fold, 1,000-fold. And, even if the men's sperm is mobile and fertile and has a normal, normal structure, um, having more sperm swimming stronger, longer, enhances the woman's chance of getting an egg out there to the right location at the right time to get fertilized. And so, what we do is we're treating the men and the women simultaneously
Right.
uh, to increase egg production and then egg motility to the implantation site, and we're treating the man simultaneously to enhance sperm counts.
Makes a lot of sense. What about testosterone production for, is there?
Increases, yeah, it increases. I haven't seen an actual study, but I know factually in my patients that if you treat them, you check a testosterone level before you treat, and then you treat with photobiomodulation, and then you come back 2 to 4 weeks later and you check the level again, it's always higher.
And that's beautiful, and that's one of the things we start lacking, right? As we get as age.
Exactly. And we also do a lot of performance enhancement. I don't know if you have been having athletes calling you, but they should be calling you. We do a lot of performance enhancement. That is, before a sporting event, we will light up the area of the body that fails first. So if you're a bicyclist, we might treat your legs. If you are a pole vault, we might treat your arms. If you're a pitcher for the Baltimore Orioles, we'll treat your pitching arm. Whatever part of your body fails first, we enhance, in my opinion, by maximizing intracellular ATP. That is, by enhancing ATP before the event, what I call performance enhancement, we're able to maximize your sporting activity. Our swim team, the U.S. swim team's been using this technology for a while. People often wonder, how do our swimmers come back to back events and win?
Right.
Well, it's because we're lighting them up. We're lighting them up in the training room between events.
And I had that experience probably about 14 years ago. There was a racquetball tournament, and it was at a high school, and a private high school. And the coach said, Tom, he says, it doesn't look good for us because we just came off of an event 2 days earlier, and we're still in rough shape from that. And I said, I welcomed them all to get a light treatment on my light bed. So before they were going out to play, whichever ones were first to go out, they were the first ones to get treated, and everyone else of the team, and they ended up winning the tournament, and the second time around, and they wouldn't have been able to do that. I've also worked with a woman who used to be the luge. She's one of the most senior Olympians. They call her grandma, and she couldn't do the luge anymore, so she's doing the bow and arrow, the archery, and she's pulling that bow that's got 42 pounds force on it 200 times a day, and she had troubles in her hands, and she was using my light constantly to keep on top of that, and she didn't make the cut. It was so close. She competed against much younger folks with her body, and she just missed it by a mark, but then turned around and won the world championship for another level, with her abilities, with the, and that exact thing you're talking about, pre-treatment and post-treatment is
Yes.
huge for these athletes. And if they're not doing it, they should be. And I even think that, when it comes to our helmet, the whole thing on the sporting events where you're talking football or soccer or other types of forms where where you may get hit in the head, to be able to pre-treat the brain has got to be beneficial to take on a certain amount of trauma. Not suggesting you try and set yourself up to get hit in the head, but it certainly, I think your brain is going to do a little bit better if those cells are all pre-charged, so to speak.
Oh, absolutely. And the sooner the better with concussions. I believe that you'll see a day when EMS rescue will have a unit like yours, in their ambulance, so that any time they roll in on a head injury or a concussion, that they will go ahead and immediately, right then and there on the field, start treatment of that concussion. What we're seeing is the sooner you treat these concussions, the better.
Yeah. Now, some would say, "Oh, but you got PBM promotes blood flow, so don't use it in the beginning." If you got trauma, that you're laughing like I am, because I've seen they can't explain how this person who had that bad of a concussion, how they're not scrambled, the way they would be. Like I've had the ones that days after they're still scrambled, but getting the PBM treatment that quickly, the sooner the better, right away, is going to be so much more beneficial to them. But within 1 week, we've got kids that were really bad concussions, and how much it's helped them. And so it kind of speaks to as well. We talked about inflammation on the brain. Would you not say that that's a common trait between Parkinson's, strokes, concussions, all those kinds of things? That if we can help reduce the inflammation, it's going to help. It may not solve all the issues, but it's certainly going to help. Would you say that that's also a common thread in many cognitive problems?
Yeah, I think it goes back to what you and I opened up with tonight, which is we've never met a medical condition where treating cellular dysfunction, mitochondrial dysfunction, we've never met a medical condition that we couldn't improve. And the reason being is that every cell that has mitochondria, which is most cells in the body, virtually every cell of every organ in the body has mitochondria, um, can be improved. That is, the function of that organ, the function of those cells can be improved through the application of light. It just goes back to restoring cellular homeostasis, that is, cellular balance in cells that have become dysfunctional because of injury,
Yeah.
any type of injury. It can be
Yeah.
burns, sun, anything. Right.
Yeah. Yeah. To help the cell balance. So, we've seen people that are hyperthyroid improve their condition, hypothyroid improve. So it not only brings down certain types of improves the regulation down, but it also improves the regulation up. It's exactly like you say, where at least that's what we've seen, is the balance is restored where it's supposed to be.
Yeah, I think it's the balance, Tom, and I think it's also, don't forget its effects on the immune system. The effects of photobiomodulation on the immune system, our body's immune system, is tremendous.
Mm-hmm. Yeah.
And, I often do what I call a systemic treatment of patients who come in with sepsis, viral infections, the flu, influenza, and you say, what's a systemic system? I treat the neck. Because where is the one place in your body that you can treat all the body fluids at one time? Posterior spine, posterior cervical spine, or the anterior. But what you're doing is you're treating, think about it, the venous blood, the arterial blood, the CSF, and the lymphatic circulation all flows through that area quite rapidly and carries the energy to where it's needed.
Mm-hmm. Yeah, it's really fascinating. I find that we know that we can't exist on this planet without light, but I just see light as just not light out there, but it's created. It's so special, it's so finely tuned. And if we can use a little, that's all all we're doing with this light technology is using a little bit of it for using it, gathering it, it's not so easy to go out in the sun and yet that'll help you out there. But you can increase the levels with this and do it indoors where you couldn't normally do it.
Yeah, no, I agree. And I would, your viewers tonight, your professional team here that's listening, I would encourage you that as you purchase your units, you must purchase quality equipment like SunPower. You must have equipment that has good diodes, good sources of specific wavelengths, red light, near infrared light, and Tom tells me in a year or so, maybe some pulse blue light. But you need to have durable, reliable equipment. Think about Miss Salisbury every day for 6 years. She used that thing every day for 6 years. And did I ever call you for a service repair?
No,
No, no,
no.
no. You have to have quality light. One of the reasons the science has been held back is from the junk that's being sold on Amazon and other vendors online that is not effective. That is, it doesn't have the specific wavelengths, doesn't have the power density, that is the amount of energy necessary to help heal your body. So as you go out and you make decisions about purchasing equipment, you need to buy reputable equipment that's durable, reliable, and produces the wavelength, that is the energy necessary and the wavelengths of necessary in order to get results when you're trying to heal yourself or trying to heal your family member. It's so important, Tom, and that's one of the reasons that I've always been, following your work very closely because you've done that. You have insisted from the very beginning that your equipment be top notch, good quality.
Thank you. Thank you very much. It's nice when people see that, and that's a nice example you said about her using it that long it hasn't, unless they put it in the casket with her as somebody else is using it now. Yeah. So you can't take it with you. Hey, and that's also when it comes to the funds, our units do cost more, but that's because we build them here in North America. We try and do our best. We have a great team here to support that, to look after questions and everything else. So that's part of the equation, that we stand behind what we're selling here. But we also love the fact that once in a while we can do something for other countries, and I'm so glad to hear our units have finally got through customs and our guys started to be used. That's beautiful. So what I'd like to do just right now, Dr. Baker, is just take a moment. I'm going to just talk about the product, and then we got quite a number of questions we got to come back to. So I'll keep it very brief here. Thank you. Okay, so we have three products in the Palm series. We have the Professional, we have the Ultimate, and then we have the 660, the 660 1050 nanometer wavelength. That's for the Super Palm. So it's the the Palm Professional 660 nanometer 810. The Ultimate is 660 810. And the Ultimate is actually 25% more power. And then we have the Super Palm, which is 660 1050. 1050 has the potential to possibly penetrate a bit deeper, but it's also got some other mechanisms. Everybody doesn't. The research isn't in yet as to why 1050 seems to be giving us an edge on some of these things some of these types of treatments. We've had really good results with the Professional and the Ultimate, and sometimes when people have used the Super Palm, it's just like an extra thing that even I've had a couple people that have both lights and they say, hey, the 1050 Super Palm seems to give them a little bit more, a little faster, whatever it is. So we have those wavelengths in our unit, and as I mentioned, we have our unit is got patent pending cooling system on here. That's why we can run it continuously without this device wearing out that way. We run it off of low voltage DC, and it just plugs into the wall. And then there's no batteries to recharge or wear out. And this is very portable. As Dr. Baker flies around, you can easily pack this in your luggage and take it with you. And even we have had the occasion. Some of you might have seen the couple slides I had where people have actually been treated in the airplane while we're flying at 5 miles in the air. So because we don't have lithium batteries in this, the safety level is very high, so there's no issues that way. So we have the 660 and the 810. The 810 is the near infrared, and then we have the other unit that has the 1050. So we have those. I alluded to the fact that we have the mini canopy that is for much larger areas of the body with the 660 and 810. So that's extremely powerful. So again, you'd have to, if you tried to buy one of those other devices that are, this large, you have to shrink it right down. And when you did and kept the same number of LEDs and everything, now you start getting, you get to the power of what we have, the power density. And as Dr. Baker alluded, that power density, when he's talking about 40 joules, you'd have to sit there all day for some of the devices to deliver 40 joules. And that's because it's 40 joules on the surface, but much, much lower as you penetrate an inch, 2 inches into the body. Those levels are very low. So having more at the surface, more power delivered at the surface, allows you to get more into the joint or the deeper joints that you're trying to reach. So that's with those devices. We've also had a lot of things, really neat successes with our helmet. And on the helmet, we have the 2 wavelengths as well. We have the 660 nanometer wavelength that just goes onto the head like this. And we've had some really, really good results across the board on all different kinds of issues, cognitive issues. We're going to be starting a study with autism because we've seen some really good results on autism as well. Oh, by the way, and then it does have the 660, and it has in this case, the 810 nanometer. And if a person wants, they can move to the super helmet, which has the 660, 1050 nanometer wavelength. So those are the different devices we have. And we stand behind our product with warranties. We have on the Super Palm or the helmet or the mini canopy a 2-year warranty. You can even extend that. So whatever you want to do that way, but these things are built to last, and that's what we like to do. So at this point, I'm going to call Dr. Baker back in, and we're going to start answering some of these questions. Beautiful questions that have been coming in. Okay, so do you, okay. Oh, good question. From Carla, we're at the top there with the questions. Okay, I'll answer the Carla because I just saw it. So Carla's asking, I missed the part of the conversation. What did the doctor say about, okay, we didn't talk about progesterone, I don't think, but maybe you could. If does the PBM help, and how does it heal? How does it treat to increase it, if that's the case? We were talking about testosterone, but go ahead if do you have some experience on that?
Well, we do. Number one is that we have found that in terms of prescription medications that women often use to enhance their fertility, we have found that with PBM, those additional supplements are not necessary, and in fact may inhibit pregnancy, inhibit fertility. So in terms of oral supplements of estrogen or progesterone, we do not have our mothers who are attempting to get pregnant. We do not have them using supplements, Tom. Now,
Okay.
secondly, is in terms of natural enhancement, it may help cells to restore to a normal level, but we don't believe it does anything supernatural. We think at most it just helps cellular hormone levels to return to a normal stasis.
Right, right. I had an interesting situation. A woman that has menopause. Thank you. I've got people helping in the background here. So menopause, we had a woman that was diagnosed with I can't remember it, but with the menopause, it was an extreme case of menopause where she's like Dr. Jekyll and Hyde, like it's not even close to anything like that. And she said they were just suggesting being on the pill. And she said for 2 weeks she would be incapacitated, couldn't handle the kids, couldn't do anything, and she just started using the helmet, and she can't believe it. She's like hugging my daughter because my daughter encouraged her to give it a try, and it just like almost totally wiped out the symptoms that she was having just by using the helmet on the brain.
Yeah, and that's another area, a similar area is menstrual cramps. For women, we have women that come into the office with profound, severe cycle pain, menstrual cramp pain, that's just disabling for 2 to 5 days. Photobiomodulation treatments can actually wipe that out. And one of the nice things about some of your equipment, Tom, and I've sent some people up your way, patients and possible customers up your way, is that I don't need them coming to the office every month for a treatment. But if they treat themselves a day or two before the cycle's due, with any of your equipment, the Palm Pilot or any of your equipment, um, they will prevent the severity of the menstrual cycle.
So what day would that be? What?
Well, if they're recording the day by temperature, that is monitoring their temperature as an indication of ovulation, it would be 1 to 2 days before ovulation occurs.
Okay, all right, very good, very good. Thank you. I got a question from oh, I'm sorry, I can't pronounce your name, Budajin. What about chronic condition like type 1 diabetes? If you've had it for decades, what improvements are possible? Yeah, can you have you been able to see something happen with type 1 diabetes?
Yes, type 1 and type 2 diabetes with patients that will treat themselves on a regular basis. And that's one of the beauties of some of your equipment. It's portable and it's usable at home. And if they will treat themselves, not daily, but at least 3 times a week for a 20-minute treatment with red and near infrared light, what we've seen is a significant reduction in insulin requirements.
Yeah, you know what? That's so what we saw with one person with type 1 diabetes. He treated the area. When he would treat, he almost had to reduce his insulin levels to half. But he needed to do it on a regular basis. If he missed it, there was no carryover. It seemed in his case, he would have to take the full dose if he didn't do the light therapy for that. It required on an ongoing basis. That's what.
Yeah, and what I've done is, you're right, is I have patients treat themselves 20 minutes a day for 3 days a week. They put themselves, they can be while they're watching the news, opening the mail. I don't want to say while they're sleeping, that's probably not good practice, but they can virtually apply the 20-minute treatment virtually anytime. You know what I mean? Um, I've treated myself, but I'm a doctor. I've treated myself while I'm taking a nap. I hurt my ankle, hurt my wrist, I hurt something. I'll throw on the palm and treat myself while I sleep. I wake up, I'm well. I don't recommend that to
No, no,
non.
please.
I do not recommend that to
No, but
non-physicians.
that speaks to the fact that it's not harmful. So many people, oh my
Right.
gosh,
That's right.
what if instead of 3 minutes I treat it for 4 minutes, is my leg gonna fall off? No, no, no. You know, uh, no, it's not gonna happen. So, by the way, there's a Tony Hewitt. You raised your hand. We take your questions through the please put them in the chat and we'll try and address them, okay? Okay, next question here. Tom is asking, Tom Kendall, Could the vagus nerve be helped with the palm light and PBM? If so, what frequency might work best? Frequency being maybe treatment, either how often doing the treatments, or they may be speaking wavelengths. So we're not sure here.
Yeah, with the vagus nerve, I would use the protocol of red and near infrared light both. My favorite wavelength, as you know, my personal favorite wavelength in the whole world on a desert island is the 810. I believe that 810 can treat more conditions successfully than any other single wavelength that I've had. But I rarely use 810 alone. I usually mix it with 640 or something in the red light range along with the 810. And yes, the vagus nerve can and will be positively impacted. And the schedule I'd put myself on, again, is I probably start at 5 to 10 joules per centimeter squared, treat the area that's affected 3 days a week, 20-minute treatments. I like to spread the treatment over time when I can, when the patient has time. But yes, it will help and you will see improvement with time.
Thank you very much for answering that question. I've got a sensitive question here. I'll let you answer it. Otherwise, I might break out and not be able to contain my strange colors on my face. So I got a question from Crystal. Where do you apply the light to increase sperm count? Is it still on the abdomen? So
On males, you could do it on the abdomen, but the best place is posterior testicles.
yeah. All right. Thank you. We've had people treat from below and above the just below the belly button as well for prostate issues, and really good improvement for benign prostate on a number of people with using the light that way.
Now I've carry a light in my black bag, and that's one of the reasons is I usually carry an 810 of some sort in my black bag, and the reason being is that you come across a male who's in urinary retention when I'm making my house calls. Patient calls me for abdominal pain, but they're really in urinary retention, 1,000, 1,500 cc's of urine in their bladder. You can release that urine by treating with 810 over the anterior abdomen in the direction of the prostate.
Thank you. Thank you. Matter of fact, one fellow that got a light from us, he says he was suffering with benign prostate for 25 years, totally cleared up now. He's cannot believe it.
Yeah, I don't know if this is a family show, but for men who want to enhance their performance sexually, photobiomodulation is the single best tool, not the blue pill, not the red pill, but photobiomodulation is the single best tool you can have for enhancing your performance, your male sexual performance. Yes.
That was well said. Uh, um, okay, so Buttigieg is, and I'm sorry if I'm destroying your name pronunciation, but he is asking, could you say something about treating early Alzheimer's disease with transcranial photomodulation helmet and its relationship with stem cells?
Well, Tom, I need to get one of your helmets. I've decided I'll talk to you offline about getting one of your helmets into my clinic. But what we're doing currently is we're treating the cervical spine and treating the cranial vault simultaneously. But I like your approach better. That is circumferential treatment with red and near infrared. I like your approach better. But what we've been doing is, again, yes, you can improve Alzheimer's dementia. The problem, Tom, that we have in our clinic is maintenance. That is, we can improve the Alzheimer's dementia and improve cognitive function, but it really requires lifetime home maintenance.
Yeah, yeah, that's yeah. Otherwise, you're losing it. you lose if you stop doing it. And the other thing is obviously doing all the right things nutritionally and exercise and all those things mixed together. Photobiomodulation does absolutely beautiful, and even better when you combine it with other modalities that, so it's a whole health approach. Getting off the Wheaties in the morning or Cheerios or whatever you've been consuming. So yeah, thank you
Yeah,
for
and I think
answering.
that's true. Just to interrupt you while we're on this topic, all of the neurological diseases respond similarly, whether it's concussion, stroke, Alzheimer's dementia, Parkinson's disease, multiple sclerosis, multiple dystrophy. They all respond similarly to light. But one of the exciting things that you figured out, but other manufacturers haven't, is that there's maintenance for these neurological conditions until we better understand them and understand why we're getting such good results. It does require weekly maintenance at home.
Yeah. Yeah, very good, very good. Okay. Marilyn is asking, have you had much experience with vision loss, particularly macular degeneration? I'll let you answer that first and I'll follow up with that one.
The answer is yes. It's now well studied and several articles out. And there's actually other manufacturers that have created machines specific for the treatment of macular degeneration. But Tom's approach earlier in the conference tonight discussed the use of photobiomodulation through the closed eyelid, which can be very effective, particularly in early disease.
Yeah, and for those that are wondering, well, why would you close your eyelid, when you do this treatment? First of all, there's a lot of energy here, and it helps reduce it a bit, but also, the eyelid performs a beautiful thing of diffusing the light in all directions. So it's such a uniform light field after it passes through the eyelid that it's going to present a very nice uniform light field on the back of the eye, on the retina and everything else. So using the eyelids closed, 1 minute of the red, 1 minute of the near infrared. And we do have people that have been helped with macular degeneration, whether wet with floaters or dry, both kinds of conditions. We've seen it help the eye health to improve that situation with even clarity. And the craziest, I mentioned that earlier, the craziest thing that we've seen is there's a couple people now we've got, we can call them up and put them on the phone sometime, but where they've had totally a vision loss. And as a matter of fact, the 95-year-old woman in Toronto, for a whole year, she was blind, could not see anything. The first time after 10 days of treatment she had one of the units at home, she was able to see her daughter's face. And as a matter of fact, to such an extent, she was able to make out the numbers on the back of the jerseys on the hockey players. And she really wanted to see the puck as well because she wanted to witness the Maple Leafs winning. Well, that's a bigger miracle than seeing. So, anyways, she's going to have to wait around for another whole year now. So maybe by then she'll be able to see the puck if she's still on this side of the earth, So, anyways, let's see. We're coming up. Coming up close to the end. We got a couple more quick questions. Are you still okay for a minute or two yet?
Yes, I am.
Okay. Is there more down on the bottom there? Okay. Yvonne is asking, am I looking at having the mix of 660, 810 and 1050 all together or the two? It's possible. We're not doing that at this point in time, but if we would, we'd still probably have 660 and then maybe 810, 1050 mix. That would be a special unit. But I really do like the 810, but I've also seen some really cool things happen with the 1050. So we just don't have there's not enough research out there yet. And wouldn't you say that'd be the best thing that could happen is more research coming down the pipe on more on 1050, what's going on?
Yeah, I think the more we understand about the wavelengths, for example, with pulse blue light, the reason I'd ask you about pulse blue light is that Dr. Buma, Violet Buma, and I are going to be publishing an article soon where we found that pulse blue light completely eradicates MRSA infections.
Okay.
Let me repeat myself. Completely eradicates MRSA infections. In
Okay.
fact, we found virtually no bacteria that did not respond favorably with pulse blue light, which is very safe for humans, of course. And you know how serious MRSA is. So,
Yeah.
yes, we need more research on pulse blue light. We need more research on 1050. I know the Australians are also very big on 1050, but I don't fully understand how it's absorbed, what its chromophore is, and how it's absorbed, and how it benefits so much. I mean, it appears clinically to be very beneficial. I just don't understand why.
You and me both. You and me both. We need to learn more or more needs to be researched in that area. So yeah, John is asking, John, and thank you everyone for asking all these questions. They're great, but we are going to wrap it up in a minute here. So John is asking, Tom, does this help with asthma? And I have seen cases of asthma and COPD improve, including the whole thing with COVID. And I should be using it tonight because I got this bad cold that just came on. But wow, what it does for the chest is amazing for the lungs. We're at this point now. People love asking questions, but I think okay, one final question here. You got Sigrid, you got the last question. Okay, can this be helpful for kidney damage?
Oh, absolutely. I first found that out. Our good friend, who's a veterinarian down in Virginia, was using photobiomodulation exclusively for the treatment of cats with renal disease. As you know, cats, a common cause of death is renal. And so he came up with a protocol for treating his critters, his cats. So I started treating my patients with acute and chronic renal disease, and kidney stones works very well for the pain of kidney stones.
Okay. Wow. Well, I want to thank you for coming on board tonight. Isn't it? I really believe that light is something that was designed. What's your thoughts on that in 1 minute or less? You think we got some design light? Sure, this is designed, but I meant out there, the sun is really special to our life. And I think there's a creator who put this together for us, all the proper living conditions. Unfortunately, a lot of those things have been messed with, and it's causing all sorts of problems for human health. Uh, would you say that is similar thought?
Yes, I don't think there's any doubt in the background you have the rainbow. I don't think there's any doubt that the colors of the rainbow are the colors of photobiomodulation, the wavelengths of photobiomodulation that all have medical applications. I don't think that's by accident. I think the creator was showing us all along the wavelengths that we needed to be using to heal ourselves.
That's not neat. That's neat. Well, I want to thank you so much for coming on tonight. That is great. I know a lot of people are going to be benefiting from this program. Thank you, Dr. Baker, for coming on. And I want to thank everyone for joining us tonight. And remember, please go to our YouTube channel as well and subscribe because that'll keep you up to date with the latest videos. Like Dr. Baker's video will be up within about a week, maybe sooner. Anyways, thank you so much, and may God richly bless everyone who's been on this week. And please visit our YouTube channel, like and subscribe. And I hope to see you next week. And also remind people to come on board next week, Tuesday. Thank you very much, Dr. Baker, for coming on.
Good night.
Good night.